13 Weird signs of low vitamin B12, symptoms of vitamin B12 deficiency. 1. Strange sensations in the hands or feet. One of the most peculiar symptoms of vitamin B12 deficiency is a tingling or numb sensation in the hands and feet, often described as pins and needles. This happens because vitamin B12 is vital for nerve health, and without it, nerves can become damaged, leading to these unusual sensations. Vitamin B12 is crucial in the production of myelin, the protective sheath around nerves. Without enough myelin, nerves can't function properly, leading to peripheral neuropathy, a condition that causes tingling, numbness, and even burning sensations. If you notice these sensations frequently, especially if they appear without a clear cause, it could be a sign of vitamin B12 deficiency. 2. A swollen, inflamed tongue, glossitis. A swollen, red, and inflamed tongue is another surprising sign of low vitamin B12. This condition, known as glossitis, can make the tongue appear smooth due to the loss of papillae, the tiny bumps on the tongue that contain taste buds. Vitamin B12 is involved in the production of red blood cells, and a deficiency can lead to a reduction in these cells, which in turn affects the oxygen supply to tissues, including the tongue. The result is inflammation and swelling. In addition to the tongue appearing swollen, you may also experience pain, and your taste may be affected. 3. Pale or jaundiced skin. Having pale or yellowish skin can also be a subtle indicator of vitamin B12 deficiency. This happens due to problems with red blood cell production. Vitamin B12 is necessary for the production of healthy red blood cells. Without enough B12, the body produces large, immature red blood cells that break down more easily, releasing a pigment called bilirubin, which can give the skin a yellow tint. If you notice a persistent pale or yellowish hue to your skin, it might be time to check your vitamin B12 levels. 4. Mouth ulcers. Mouth ulcers or sores are another strange but possible symptom of low vitamin B12. These sores can be painful and often appear on the inside of the lips, cheeks, or under the tongue. A deficiency in B12 can affect the mucous membranes in the mouth, leading to ulcers. This can be compounded by the weakened immune system, often seen in those with low B12 levels. Frequent or recurring mouth ulcers, especially if they occur alongside other symptoms of B12 deficiency, should prompt further investigation. 5. Blurred or disturbed vision. Another odd symptom of vitamin B12 deficiency is blurred or disturbed vision. This can occur when the optic nerve becomes damaged due to prolonged low levels of the vitamin. Damage to the optic nerve, which connects the eyes to the brain, can lead to vision disturbances. This condition is known as optic neuropathy. If you experience sudden changes in your vision, such as blurriness or double vision, without any apparent cause, it could be linked to a lack of B12. 6. Mood changes. Vitamin B12 plays a role in the production of brain chemicals that affect mood, and a deficiency can lead to mood changes, including increased irritability, depression, or anxiety. B12 is necessary for the production of serotonin, a neurotransmitter that helps regulate mood. Low levels of B12 can lead to decreased serotonin production, which may result in mood disorders. If you notice a sudden or unexplained change in mood, especially if it's accompanied by other symptoms of B12 deficiency, it might be worth exploring your B12 levels. 7. Difficulty walking and balance problems. Difficulty walking, balance problems, or unsteady movements can also indicate a vitamin B12 deficiency. This is because low B12 levels can cause damage to the nervous system. The lack of B12 can lead to damage to the nerves in your spinal cord, which are responsible for coordination and movement. If you find yourself tripping, stumbling, or having difficulty walking, particularly if it's a new issue for you, it could be related to low B12 levels. 8. Breathlessness and dizziness. Feeling short of breath or dizzy can be a sign of anemia, which can be caused by a deficiency in vitamin B12. This occurs because your body isn't producing enough red blood cells to deliver oxygen to your organs. Without sufficient B12, red blood cells can't form properly, leading to anemia. This reduces the amount of oxygen that's available to your body, leading to feelings of breathlessness and dizziness. If you're frequently feeling out of breath or dizzy, especially during normal activities, you should consider checking your B12 levels. 9. Cognitive impairment and memory loss. Low vitamin B12 levels can also affect your cognitive abilities, leading to memory problems or difficulty concentrating. This is particularly concerning because it can be mistaken for early signs of dementia. B12 is essential for brain function, and a deficiency can lead to cognitive impairments, including problems with memory, concentration, and reasoning. If you're experiencing forgetfulness or finding it hard to focus, and these issues are new or worsening, it could be linked to low B12 levels. 10. A high temperature. Although it's rare, some people with a B12 deficiency may develop a high temperature. The reason for this is not well understood, but it is believed to be related to the body's response to the deficiency. Some researchers suggest that a fever could be the result of the body's immune response to the stress caused by a lack of B12, although more research is needed to confirm this. If you develop a fever without any other signs of infection, and particularly if you have other symptoms of B12 deficiency, it's worth checking your B12 levels. 11. A glossy, smooth tongue. In addition to swelling, vitamin B12 deficiency can also cause the tongue to appear glossy or smooth. This is due to the loss of the papillae, which contain the taste buds. The loss of papillae is another result of reduced red blood cell production and poor oxygen supply to the tissues of the tongue. A smooth, glossy tongue, especially if it's accompanied by a loss of taste, could be a sign of vitamin B12 deficiency. 12. Infertility and reproductive issues. Low levels of vitamin B12 can also lead to infertility and reproductive problems, particularly in women. This can include issues with conception or maintaining a pregnancy. Vitamin B12 is important for reproductive health, and a deficiency can affect ovulation and the health of eggs in women. In men, it can lead to low sperm count. If you're having trouble conceiving or maintaining a pregnancy, and there's no other clear cause, it might be worth considering your B12 levels. 13. Depression and anxiety. While mood changes have already been mentioned, depression and anxiety are significant enough to be considered separately. The link between B12 deficiency and mental health is strong, and low levels of this vitamin can lead to serious mood disorders. Vitamin B12 is crucial for the production of brain chemicals that regulate mood, such as serotonin and dopamine. A deficiency in B12 can lead to low levels of these chemicals, contributing to depression and anxiety. If you're experiencing persistent feelings of sadness, hopelessness, or anxiety, especially if it's a new experience, it's important to check your B12 levels.